Paul Seegert, healthcare expert with PCS Advisers, joins us now. Paul, welcome to the program. How are you?
Doing great, Leland. How are you?
Good to talk to you. Let's start with the pause in the J&J vaccine. The reason is because there were 6 cases, women between the age of 30 and 45, who had dangerous problems with blood clots. I saw an update on this today that 4 of those cases were taking some type of a blood thinner medication. So now there's a thought that maybe that's part of what's interplaying here. They think this pause will last 7 to 10 days. I saw an interesting poll that it hasn't hurt people's overall poll numbers on whether or not they find the vaccine to be effective, although it may have entrenched some who don't think it's effective. But what's the reason behind this? Why the pause at this moment?
Well, they're saying it's out of an abundance of caution, and I'd say that certainly seems true, since you are, to kind of put it in perspective, twice as likely to get hit by lightning than to get blood clotting from this. Not that it's not serious, but you're twice as likely to get hit by lightning as compared to having a blood clotting event from the vaccine, and you're 8 to 10 times more likely to experience blood clotting from COVID itself.
Yeah, that's interesting.
Than any of the vaccines that are out there, according to a recent study that just came out, maybe as recent as today, from Oxford University.
Now, I would propose, though, that this, and I agree with you, and I personally, like I said, I've encouraged my dad to get it. He's 80 years old. He checks all the boxes for the vulnerable. So I encourage him to get it. Me, myself, I'm waiting. I just want to see how this plays out. That's just me. I'm not encouraging anybody to do one way or the other. I am pro-vaccine choice, and I think this vaccine is probably a miracle of modern science and free markets. That being said, the communication surrounding the vaccine, the overt pressure to make it mandatory, and the contradictory statements from the government, I think, is probably what's creating the biggest problems with buy-in out there in the community. Would you agree with that?
I definitely agree with that. I mean, we've got people on TV today getting vaccinated, encouraging everyone else to get vaccinated, and not too many months ago, those very same people were saying they wouldn't take it. It's being rushed, and that was, I think, pretty clearly highly political.
Right. Orange Man Bad made it.
The bad messaging there.
Yeah, Orange Man Bad made it. Anybody who eats McDonald's hamburgers every night and KFC on his Air Force One probably can't do a vaccine, even though the president has nothing to do with it, other than just getting the red tape out of the way.
Yeah, I mean it's one of the most incredible things we've ever done. Other new news today on the same topic: the CEO of Pfizer came out here within the last hour or so and said that a third dose will likely be needed 6 to 12 months after getting the first 2, and then an annual booster.
Yeah, I think that's pretty convenient for pharmacy companies.
It's a lot of arms race that this already has gotten even bigger.
Yeah, no doubt.
It has the potential to be the biggest boon for the drug industry.
As if they needed any money right now, which leads me to my other topic that I wanted to explore with you, because you and I had a good conversation the other day on my podcast, which people can download at iHeartRadio. It's called The Disruption Zone, and it's on iHeartRadio's app, so you can go there and subscribe and download. And I actually got quite a few comments about that conversation that you and I had. We had a pretty long and in-depth conversation about fixing the healthcare system and the price and the cost, and that's really what's driving it. We don't have a healthcare problem in America. We have the best healthcare in the world. What we have is a healthcare access problem because it's unaffordable for the average American.
Yeah, and it's really the way that we pay for it that is where all the problem lies. People come from all over the world to get our health care when they have something serious going on, and they get the very best health care available. And if they're a cash-paying customer, they get very fair pricing. The cash pricing for lots of procedures has been trending down, while the price that they charge insured customers has been going up. If you look at a CT scan as an example, LA Times did a great article on this. They called all over the country and asked facilities, hospitals, and so on, what would you charge cash for a CT scan? The average answer was $287. And yet when they did that same call all around the country and asked, what would you charge if I pulled blank insurance card out of my wallet, the average answer was around $2,400.
Jeez.
That's incredible.
Yeah. Yeah. And therein lies the problem with the cost of healthcare. Let me just throw out this idea that you and I sort of fleshed out. Part of the credit goes to Dan Crenshaw, the Republican from Houston. He actually took an idea that's been out there from others. I mean, there's a lot of ideas floating around. But I love this idea. We would take and basically kind of scrap the way the system works right now. We'd scrap Obamacare, and we would start over with an HSA for every American. Every American can open an HSA. It wouldn't be through your employer. You could go down to your local bank and open up an HSA account. The banks could compete on the interest rate on it. Your employer, if they subsidize your health care now under the current system, could just shift to making monthly deposits into your HSA account. We could have a means-tested program for those who can't afford access, where they could have monthly subsidies put into their bank account or their HSA account based on their level of means to be able to access this. You could use that money for healthcare premiums, for gym memberships, for anything health related, and it would be unlimited how much you could put into it from your own money, from your employer, etc. And as long as you use it only for healthcare associated things, it would be completely and totally tax-free. This would encourage savings for self-insurance, and people would be then immediately in charge of choosing their own insurance, which would inject competition back into the market, and it would also inject consumer choice, which is what's completely missing right now. Why can't we do that?
That's what we need to do, some version of what you just described. Anything that brings more transparency and will actually allow the free market effects to work in healthcare is going to be a huge plus, because it's surprising to people when I talk to them about this topic, but we don't actually have a free market in healthcare. We've got all these ballooning costs hidden behind a curtain of insurance, and we've taken the American consumer, one of the most powerful forces in the world, and we've got them consuming healthcare in terms of copays and deductibles. They are consuming in their own best interest, but they have no visibility to the real cost. So if we did what you just described and people were able to go out there and actually price a procedure, look at where can I get the best cost and quality, and they started to operate based on those things, maybe put insurance back where it should be or is in many other areas of our lives for catastrophic events. Right. And consume with that HSA account in real dollars. When people spend dollars, they just behave differently than pulling out an insurance card and paying a copay.
Yeah, imagine if I had an employer was contributing, I don't know, $600 a month to my HSA, and I was putting in $200. It was all tax-free. Let's say I'm means tested, so the government's throwing in $150, whatever. I'm a libertarian leaning conservative, but I'm not heartless. So if we're going to have that conversation, let's bring everybody to the table. So now you've got all this money in your HSA. You're going out and you're choosing, I'm going to have a very high deductible policy, and I'm going to go down here to the direct primary care doctor, and I'm going to pay him $65 a month to be able to see him anytime I want, have wellness prevention, and I'm going to join this gym over here, and I'm going to get healthy, and I'm going to do these two things, and bam! Imagine what happens to the system in terms of access, affordability, choice, consumers driving it. I mean, to me, that just seems like a no-brainer.
I agree. This new transparency rule that kicked in January 1 for hospitals, which really actually wasn't new. It was part of the original ACA, probably one of the few good parts of the ACA, and it was finally somebody had the gumption to enforce it, has revealed something that we've been taking advantage of for a long time in building health plans, and that is the average hospital has more than 150 prices for every procedure they perform. That's crazy.
For each procedure?
Yeah, for each procedure. And they fought very hard to not have to comply with this. And it went, through the courts, and they ended up having to do it. And now they're even suppressing it so it doesn't come up in searches when you Google search it and stuff. So it's incredible what it's revealed. Here's a quick example. Looking into a health plan that we're managing, there was a minor heart procedure, which sounds stupid to say, like Drumbo shrimp or whatever, but there was a minor heart procedure that needed to be done. And the same surgeon in the same OR doing the same procedure, depending on what card came out of the wallet, it would get billed anywhere between $80,000 and $540,000. Same procedure.
Jeez.
That's how crazy our payment method for healthcare is. Why can't we have I mean, there was a great article in the Wall Street Journal recently on this. They asked a bunch of hospital systems, what does it actually cost you to do a total knee? Their costs or their billed charges are so high above the actual cost, they don't even run a PLNL on it. They don't need to.
Right.
And at the end of the day, what they found out is it was closer to $10,000 than you'd think.
Wow.
Very close.
Yeah.
And yet the billed charges for that could be $140, high as $270, all over the map.
Wow.
And so what if they had to publish pricing? And like any other industry, you shouldn't need 150 prices. There's only one reason you would be doing that, to charge more.
Yeah, exactly. That right there, you look at that. That's why there's so much pushback against common sense solutions like what we've discussed. Paul Seegert, healthcare advisor. Thank you so much for your time. I appreciate it.